So I heard that you're wondering, what does a child psychologist do? I think I can help you with that. So I got to tell you right up front, when people find out that I'm a psychologist, some of them want to spill their whole life story to me. It's like I can't turn them off. And other people don't dare tell me a thing. It's just kind of funny. I think a lot of people misunderstand what psychologists do. Since you've joined me for this episode, you're probably wondering about a child psychologist specifically. My wife teases me a little bit because when people find out I'm a child psychologist, they say, yeah, and sometimes he works with children too. I'm trying to be more mature, but it's overrated. There's a lot of different kinds of psychologists, even in child psychology. School psychologists, for example, are typically master's level professionals who work exclusively in a school environment. They focus a lot on assessment and interventions in the schools. Behavioral psychologists focus on behaviors, typically disruptive behaviors. And there's a lot of room for that in the industry of child psychology. Clinical psychologists tend to work in clinics or more clinical settings where they work on pathology and the diagnosis and treatment of mental illness. That can be particularly challenging for a child psychologist because diagnosis is so tricky. There's a lot of different things that manifest for children that might represent totally different problems. And it's kind of tricky for a clinical child psychologist to sort all of that out. There's also academic and research-based psychologists who focus more on studies and research to try to come up with new treatments or interventions or simply understanding how things work. Psychology is such a diverse field, it can be a very rewarding direction to go if that's something that you're considering. Let's talk about the area of child psychology specifically. Child psychologists are specially and specifically trained to work with children and their caretakers. Now, I added that second part because really every child psychologist has at least two clients. The child, but children don't call and set up appointments. I have never had a 7-year-old call me up and say, Dr. Paul, can I come and have an appointment with you? Somebody else is taking care of them. And so as a child psychologist, you're going to need to have the skill of working with those caregivers as well, usually the parents. But in my history as a child psychologist, I've also had to work with social workers and foster care providers and group home leaders. There's all kinds of caregivers that work with children who are the gatekeepers for those children to access services. A child psychologist needs to know a lot about human development, how kids typically would hit their milestones and develop and gain skills and abilities to interact with others socially, to communicate. And so child psychologists also would often function as part of a multidisciplinary team. There might be behavior specialists or speech-language professionals or occupational therapists who are working with this family as well. I'm reminded of the old saying that it takes a village to raise a child. I think that's really true, especially for working professionals who focus on children. Before I conclude this video, if you're considering either hiring a child psychologist to work with you or with your children, or if you're considering going into the field as a professional, I would strongly recommend that you talk to some people who are doing it. If you're a parent especially, interview the professionals that you're considering bringing in to work with your kids. They are working for you, not the other way around. And I've found a lot of times in child psychology especially, the professionals kind of take over and tell you what to do as a parent. You're still the parent. So make sure that you approve of whatever professionals that you're working with your children. That is a huge responsibility for you. And I want you to stay in the driver's seat as the parent. If you're going into the field, find someone who's doing what you are considering doing and interview them. Find out more. Ask them a lot of questions like, what do you enjoy about this job? What is it that challenges you? What are some of the pitfalls that I should look out for if I'm going that direction? It's a really great way to get more information for yourself so that you can make good decisions. Now, before we wrap up this video, I want to introduce you to something that you might not encounter regularly in the industry of child psychology. And that is the distinction between traditional psychology and positive psychology. If you've been here on the channel very long, you know that I am a strong advocate of positivity and positive psychology. Traditional psychology tends to be focused on diagnosis, pathology, treatment. So one of the main questions is, what's wrong with you? And can we put a label on it? And is there a treatment approach that will help us to overcome the deficits? Positive psychology is on the other end of the spectrum. If you think of your mental health or your child's mental health on a spectrum or a continuum, clear over here on the left end is the sick end. That's where we have diagnosis, pathology, treatment. The other end is really fascinating. And to understand that end, let's go to the middle first. The middle is health. Health meaning not sick. You'd think health is the opposite of sick. I just mean not sick. So you could be sick in bed with a fever, throwing up. There comes a time when you can get out of bed and you're not sick. But that doesn't mean you're truly fit, thriving, prospering. That's the other end of the spectrum. So if you think of this entire spectrum, traditional psychology focuses on the left end of that spectrum, the pathology end. And there's a lot of really important research and treatment approaches that are being innovated over there to help our kids who are really struggling in that zone. Now, this end of the spectrum, clear over here on the right end, this positive end, is not picked up by insurance companies. It won't be referred by the Division of Child and Family Services. This part of the spectrum is for kids who are not sick, right? But not sick doesn't mean truly thriving. So the positive end of the spectrum focuses on adaptive behavior and how to really succeed in our relationships and social interactions, in our cognitive abilities, in our psychological life. So I've moved my practice from this end of the spectrum, where I was for about 12 years or so, over to this end of the spectrum, where I'm having a lot of fun. And there's some overlap in the middle, because everybody's got issues. I think this is true when we talk about child psychology as well. And it's important to acknowledge that kids who have issues, and which kid doesn't, may not be sick. They may be human. Welcome to Earth. Everybody's got issues. And we can deal with those according to principle, like the ones that we talk about here on the channel, in a way that allows us to move farther in that direction. And that's really good news. I think it's been far too common of a practice in our society to overdiagnose children, because sometimes when a parent is frustrated and they go in for help with someone who's on the traditional end of the spectrum, the first thought is, what diagnosis does this child have? And there are some that just come out of the blue. Attention deficit hyperactivity disorder, for example, which is a legitimate diagnosis, but which often means adults in this kid's life are frustrated with a behavior that they're observing, or a set of behaviors. And that kid may or may not qualify for an official diagnosis. I think we need to consider that this may be a kid who's got some issues, but doesn't have a diagnosis. They need to apply principles to move farther to their path of excellence. which is on this end of the spectrum. I thought that might be a helpful distinction for you to at least think about as you look at this possibility of child psychology and how that can help you. I hope that gave you a couple of ideas about what a child psychologist does. If you're looking for someone to work with you on the positive end of that spectrum, which doesn't necessarily require a psychologist, you might be interested to look up liveonpurpose.coach, where Live on Purpose certified coaches might be able to help you on the positive end of that spectrum. I'll see you tomorrow.
And I wished I had a number. Sorry.